people who cover their face with a snot rag, and gentlemen. I'd like to, real quickly, I might have to insert some bumper music if I don't talk long enough, because I've got several screenshots to go over and related to this. The comment you're seeing on your screen was a debate I had with a vacuous Chicagoan named Katavideo. Katavideo. And you can see there, I was defeating her in a discussion of health care, and she was getting really angry. I said doctors are refusing Medicare patients because of reimbursements. They're too low, and this goes for Medicare, or it goes for Medicare and Medicaid. And Kaka came up with her authoritarian solution: jail doctors who refuse to treat patients. It was shortly after this she bailed out in the debate. I asked her a hypothetical: what if half the doctors in New York City, because of this, let's say you go through with your jailing doctors who refuse to treat new Medicare or Medicaid patients because of reimbursements. There's other issues involved in that, other than just reimbursements. There's paperwork. But there's a growing body of evidence indicating more and more doctors are refusing Medicare and Medicaid because of red tape, and they don't get paid. You know, doctors prefer, real doctors, I mean, not people who pretend to be doctors. I'm talking about real doctors prefer to get paid for what they do. So if, let's say, half the doctors in New York City either quit their practice, moved, or just went to jail voluntarily, what are you going to do then? What, you going to force people to be doctors? Are you going to just pull people off the streets and say, well, you're a doctor now? You can see Kaka was very upset, very angry, and she started pounding the table, and her authoritarian solution: you're going to jail. You don't agree with me, you're going to jail. However, as indicated in some of the screenshots going by, and there's several of them, and I have all the links underneath as per usual, more and more doctors are refusing new Medicare and Medicaid patients because, and one of the primary reasons is those reimbursements, and the programs are still going bankrupt. Search my videos for the term Medicare or Medicaid, and I have several videos chronicling the exploding costs of those programs. So doctors are refusing to treat them because, you know, they'd rather get paid. The old wives' tale that we need to insure everybody because it's the uninsured who are going to the emergency room most often, and for so-called non-urgent visits, not exactly true. And in some instances, it is somewhat, but shoving the uninsured onto Medicaid, which people on Medicare and Medicaid are more likely to have multiple emergency room visits, and those visits are more likely to be non-urgent. Shoving them uninsured onto Medicare or Medicaid, not going to solve the problem, folks. I don't know. Again, Kaka has not looked at any of the data related to this. She pulls talking points out of her rear end and gets talking points off of kook blogs. I also have links to the number of the exploding Medicare and Medicaid rolls, which were already on a very upwards trajectory even before Obamacare was passed. Medicare, because of demographics, we have the baby boomers are retiring. This is going to become a huge problem in the future. We're already going to be short physicians, so we could use the H-1B visa program to plug that hole. That means professionals from other countries. That doesn't mean migrants who clean the floor. Do you understand what I mean? More migrants, more unskilled migrants from Latin America aren't going to solve this problem. You need professionals. That's the H-1B visa program and other programs that can take advantage of that. Medicare and Medicaid enrollment and costs are exploding, continuing, shoving all these people onto Medicare and Medicaid. Expanding those programs, especially Obamacare expands Medicaid, isn't going to solve the problem. Another factor is people are living longer after 65, even though the infant mortality rate has gone way down in the last half century here in the U.S. But another problem is, well, I don't want to call it a problem. I shouldn't put it that way. As far economically speaking, people are living longer after they hit 65, so that's going to exacerbate the problem. So the data indicates that this massive expansion of government health care, not only is it inefficient in general, and this video is not exhaustive. I'd say all my other videos would be a good supplement on this as far as health care goes, but this won't be exhaustive. But you factor in those reimbursement rates and how Obamacare is expanding Medicaid, this is going to only exacerbate the problem. And I again have all the information down there. This is all smoking gun evidence. It's all smoking gun evidence. There's no way you can deny this. and the authoritarian solution to jailing, let's just jail those doctors, throw them in jail, is not going to fix the problem. So anyone interested, you can peruse all those links I have underneath. There's plenty of them where you can get even more information if you want. And Katavideo, old Aunt Katavideo, is a clueless idiot. Have a nice day, and don't thank me now.